Good morning, everyone, and thank you, MP Gélinas, for inviting me here today to join fellow nursing leaders in support of your important bill, the patient-to-nurse ratio for Hospitals Act 2024. My name is Dickon Worsley, and I'm a president of the Board of Directors for the Registered Practical Nurse of Ontario, also known as WeRPN. I also worked in direct patient care at a hospital in emergency room. RPNs are the second largest group of regulated health professionals in our healthcare system, with over 59,000 across the system. Every day, my colleagues and I work in hospitals, long-term care, and across our health system in every corner of the province to ensure that Ontarians have the quality of care they deserve. But the reality is the current system makes that far more difficult than it should be. Too often, we are short-staffed and forced to make impossible decisions. Do we provide full breadth of care we know the patient needs, or do we move on and provide the bare minimum to make sure the patient gets seen? Simply put, we need to increase the number of nurses per patient in our hospitals to fix this. Legislating nurse-to-patient ratios will allow nurses like myself and my colleagues to deliver improved patient care. Better care will help reduce length of stay in hospitals, which in turn will free up hospital beds and reduce system capacity challenges. For nurses, it will improve workloads and reduce stress, help to boost pride, and to make the profession that we love the valued, respected, and attractive career it used to be. MPP Gélinas, patient-to-nurse ratio for Hospitals Act 2024 presents an opportunity to address these two challenges: the need to improve patient care and the need to retain nurses in our health system. It is a critical step to help Ontarians receive the quality and timely care they deserve. In recent years, understaffing has become normalized and nurses are stretched thin. This has compromised patient care and led to morale distress and has caused many RPNs to consider leaving the profession. In fact, in our recent annual survey of RPNs, 48% of respondents indicated that they were considering leaving the profession, with wages and workload cited as leading factors. However, when we asked those considering leaving what would make them stay, 72% cited nurse-to-patient ratios as a key factor. Clearly, it is time to recognize the value of the work nurses do for the Ontario healthcare system and to recognize how important nurse-to-patient ratios are. Legislating nurse-to-patient ratio would ensure that nurses have manageable workloads to provide the highest quality of care for their patients. It would also strengthen the retention and recruitment of nurses in a profession at a time when the need for nurses is expected to grow. This legislation is based on decades of research that clearly details how nurse-to-patient ratios improve patient outcomes, reduce mortality rates, and decrease the length of hospital stays. Patients who receive care from nurses with lower patient loads are more likely to be satisfied with their care and a better overall experience. Legislating nurse-to-patient ratio is not only good for nurses and patients, but also has been shown to provide a major return on investment for our hospitals and the health system. In 2021, a study in the United States found that a 4-to-1 staff ratio prevented more than 1,595 deaths yearly and would save hospitals $117 million per year. This bill has the potential to save lives and do so affordably as a province responds to a continuing healthcare crisis. On behalf of RPNs across the province, I urge all MPPs to support this important legislation. This is a critical issue that affects the health and well-being of our communities today and tomorrow. Let's work together to ensure that our hospitals are adequately staffed and that nurses have the resources they need to provide the highest quality of care for our patients. Thank you.